I'm going to challenge you to do something that might sound completely ludicrous, given that tonight is on poverty and we've been talking about poverty, but I want you to just try to, for the next 20 minutes, 25 minutes, take poverty out of your mind. Just drop the word, don't think about it. It's really a limited framework, and it's one that has a lot of values and a lot of judgments and a lot of emotions attached to it. So I want to just drop the poverty word, at least while I'm up here, and talk with you more about how people are doing. It doesn't accurately describe how many people are struggling to get by, and for a lot of the reasons that Kevin discussed, and we'll go into this a little bit more, but I want to talk with you about trends in Iowa and what's happening with a number of people living in our state that are struggling to get by. The factors that are contributing to this. There are rising costs in the state for basic living expenses, especially housing, childcare, food to some degree, and as you heard last week, health care costs. There's also a leveling off, a declining, and in some cases stagnating wages across the state. So there's a growing gap between what it costs to live in our communities and what people are able to earn in the labor market. And that's what I want to talk with you about. And then we'll go into possible state policy responses. So I want to talk with you first about our cost of living research. We've done this research twice. We did it in 2006 data, and now we've done it again. Just released it recently using 2008 data. We intended to set out specifically and look at a very basic budget. We wanted to get a frugal estimate of what it would cost for a family to live in our state. We did these budgets for 7 different family types, and we actually did them for all 99 counties in the state of Iowa. What you have represented on this screen is just one family. It's for a single parent family in Iowa. And we really looked at a very basic level of subsistence. You'll see that we accounted for child care, clothing and other necessities. Food, we assumed that this family cooked and ate all meals at home using the USDA low-cost food plan. We assumed that their housing expenses were the 40th percentile of HUD market rates. So not even your average housing costs were going down to the 40th percentile for families. We assumed that transportation costs, this family was only driving to and from work. No vacations, no travel, no recreational use. This is to and from work. And that they're paying their income taxes. When you look at this, you'll notice there are some very important things missing. There's nothing for debt. No student debt, no consumer debt. There's nothing for savings. Saving for their retirement, saving for their families, or their for training for themselves, their children's education. There are no savings for emergencies if they get sick and don't have paid leave. This is really meant to represent a very basic day-to-day what a family faces as far as costs. You'll see that childcare, housing, and transportation are the 3 largest portion of this family's budget. These are exactly the expenses that get undercounted when calculating the federal poverty guideline, which we will talk about when we get to state policy. To provide context for just one of these, since childcare is a really large expense for families, looking at childcare, in 2008, the average annual cost for having an infant in a childcare center was over $8,000 a year. This is a 12% increase over 2007 average costs, and is more than a year's tuition at the University of Iowa for an in-state student. One child, childcare. So we determined that a family supporting wage for a single parent in Iowa with 1 child is $16.53 an hour. For 2 children, that goes up to $19.17 an hour. You can see this little line at the bottom that talks about the gap between the median wage and the family supporting wage. And why that's significant is the median wage is kind of an indicator of what kinds of wages someone could earn in Iowa. It's the median level. So half of the people in the state earn more than that, and half of the jobs in the state pay less than that. So it's a pretty good middle ground. This family is $2 to $5 an hour under what they would need to make if they were earning just at the median wage level. Can you imagine how this family is going to be supporting themselves at the minimum wage level, which is $7.25? So that's the basis of just costs, average costs right now, or not even average costs. These are conservative estimate costs of what families are facing. I did want to pull out, as I mentioned, we do this breakdown by county. So if you wanted to look at our current community, this is the Iowa City metropolitan statistical area. So it's Johnson and Washington counties together. And you'll see the wages that a family would need really in Iowa City go up. They need to earn about $18.26 an hour for 1 child. about $22 an hour if they have 2 children and they're single parents. Once you go to 2 parents with one working with 2 children, they're each going to need to earn $19.01 an hour. Or if both parents find employment and are working, they're each going to need to earn just around $14 an hour. If you look down at the bottom again, only one family type out of this, which is 2 parents, both working full-time, are earning enough at the median wage to support their family. This is what's happening that is driving so many people to the brink of really not being able to make ends meet and having to choose between basic living expenses, families doubling up, and really suffering significant economic hardship. We do have some new data this time around. The first time we did this report and put it out a few years ago, the first question we were asked, especially by legislators, but a lot of people who heard the presentation said, well, how many families does this really affect? Forget the median wage level. We want to know, of families in Iowa, how many fall above or below those cost of living thresholds. And what we found, this was in 2008, at the end of 2008, and this is only for families with young children. As Iowa's sample grows over the years, we'll be able to tell more. But for families with young children, 2/3 of single parents in Iowa earn less than what they need to meet their basic day-to-day living expenses. 2/3. A quarter, or almost a quarter, of 2 parents with 1 adult working full-time do not earn enough to meet their basic living expenses, and 10% of 2 parents working with both of them working earn less than enough to meet their basic needs. This was in 2008, and we do not expect that these numbers have improved due to the recession that we've been facing the last year and a half, 2 years. Overall trends, there was an increase between 2006 and 2008. The budgets increased by 14 to 19%, and what that really translated into for a family was about $3,200 to a little over $6,000 a year in additional costs in that 2-year period of time. Everything saw a little bit of an increase. Child care, housing, and transportation remained the largest portion of the family's budget. And there were small increases across the board, except when it came to health insurance. And I didn't have the benefit of being here last week, but I'll keep my healthcare costs limited. I do want to note that healthcare costs are dramatically increasing for families in the state. That as healthcare costs have grown over the last decade, health insurance premiums have risen along with them, and employers, when they have kept their policies, have begun passing on some of those costs to their workers in the form of either higher premiums or co-pays, both, or less comprehensive plans. For the more than 430,000 Iowans without health insurance through their employer who purchased it on the private market last year, they faced an average of more than $12,000 for family coverage on their own for the year. So as a result of both of these, people really covering costs on their own, employers passing along costs to employees that they weren't facing before, healthcare costs have really risen in family budgets. Parents have seen a 28% increase from 2006 to 2008 as far as the expenses in their budget. And single adults have experienced a 33% increase in healthcare costs. So even with both parents working, people generally think, well, if both people are working, then you can really, handle these things and these expenses aren't as much. You share that burden. Healthcare costs, which are both the premium contributions and out-of-pocket costs, consume about 13% of a family's budget, whether they have 1 or 2 children. So it's a real significant portion. The other thing that's happening, and is something that we really have to pay attention to, particularly in our policy responses, that there's been a change in how adequately Iowa's median wage, or really our whole wage structure, has been in meeting a family's basic living expenses. In our previous study, just 2 years ago, families with 1 working adult could support themselves at the median wage if they lived in the northwest corner of the state. So there was somewhere in the state with, as a single adult, you could go ahead and support your family. That's no longer the case. Statewide, there's been a growing gap between wages and the cost of living. So the only family that's able to support themselves in the state of Iowa at the median wage is a 2-parent family, both working full-time. That's a real shift, and that's just been over the course of 2 years. We know that the costs are going up. I think it's also really important to just briefly review sort of the health of Iowa's economy and to consider what the recession means for the number and the type of jobs that are available for families. Iowa was slow to be affected by the recession, but when it hit our state, it hit us very hard. In the last year, we've lost more than 40,000 jobs, and you look from the beginning of the recession, our state has lost 60,500 non-farm jobs. This is a tremendous impact for our state's economy. And to give you just a little bit of a perspective, Iowa's job growth has slowed considerably in the recent decades, and we're not adding back as many jobs as we have lost in the past. If we look at the last two recoveries from recessions, you'll see that we added, a little over 193,000 jobs after the 1990s recession in that decade, but just over a quarter of that number, 53,400 jobs, after our most recent recession in the 2000s. Looking at it another way, this is the same set of numbers, but it's just stretched out over time so you can see it. Iowa not only is adding back fewer jobs, but we're just doing it much more slowly. In our most recent recession recovery, and this is the bottom line that you'll see here in red, it took us almost 4 years to recover the jobs that we lost at the beginning of the 2000s, which is twice the rate of the rest of the nation. Everyone else, or all the other states, really were back where they had been pre-recession in 2 years. So it took us 4 years just to break even to where we had recovered the ground we had lost. And then it took us 7.5 years total to add 53,400 jobs to our state's economy. Well, in this recession, we've already lost over 60,000 jobs. So that's the hole that we're going to have to climb out of, and that's what families are facing right now. Iowa does not add back jobs very quickly, and this will be a long, hard climb for our state without some significant shifts in our economic development strategies. I'm going to say two more things about the economy, and then I'll go ahead and move on to policy responses. But additionally, and of potentially greater concern, is that the jobs that we're adding back in Iowa are not as good of jobs as the ones that we were losing from a monetary standpoint. You can see here that we're losing jobs with higher wages and replacing them with jobs that have lower wages and fewer benefits. Many of the jobs that we've lost in the last decade are not coming back, and that's something that we really have to grapple with as a state. At the higher wage end, we've seen major losses in information jobs, and this was the dot-com bust that happened. But also, we've had huge losses in manufacturing. For example, between 2000 and 2008, manufacturing lost 23,600 jobs. That's a lot of jobs for Iowa. But in the last year alone, just in 2009, half of the jobs we lost across our entire state were all manufacturing. So add to that total 20,000 jobs last year just in manufacturing alone. Those are not jobs that are coming back into Iowa. We have to replace them with something. Unfortunately, the greatest growth we've seen, and you can see those here in the yellow, have been in jobs with wages that are significantly under what we lost in manufacturing and in information sectors. So that's something that is shifting with what's available for people to even go out and earn, with the employment that they have. Additionally, there's also been a decline in employer-sponsored health care coverage throughout Iowa, which was definitely reflected in the rising costs of our family budgets. In the last decade, only education and health services saw both strong job growth, this one right here, and a stable rate of health insurance coverage. All other sectors saw declining rates of coverage. So every other sector lost jobs that offered health insurance. The result is that the state lost 42,000 jobs with health insurance between 2000 and 2008. That reflects, I'm probably getting heavy on numbers, but I will get to the point. It reflects 3,700 or 37,000 jobs just from declining employment. So the insurance was gone because the job was gone, but there were another 5,000 that the job remained, but the coverage was gone. So if we look at the trends that are happening both in job loss, in uninsurance loss, and in unemployment, we can expect employment-based coverage to fall 44,000 from January of 2008 through the end of 2010. What this means, and this is the point, 280 people a week or 40 people a day are losing employer-based health coverage. That is a policy reality that we need to deal with and shows up in these families' budgets, and they don't have the money to fill in the gap. As a result of the erosion of jobs that pay well and have good benefits, especially for less educated, we are really seeing a decline in wages across the education level, and it's started to catch up now with more educated workers. And this is not good news for anyone in this room, I know. But you can see that wages for workers with less than a high school diploma have dropped by more than 25% in the last 3 decades. It's huge. Someone used to be able to support themselves with a high school education. It is no longer the case in this state, as with many other states. But in the last decade, just since 2000, more educated workers have started losing ground with their wages as well. That's not necessarily something you're going to see in other states. And again, is something that Iowa really needs to have a response to. So possible policy responses. The challenges are immense, but there are policy options that could make a real difference in both responding to the economic crisis that families are facing and in building longer-term prosperity and security for our state. First, and these aren't all of the possibilities out there, I'm just going to throw them out from a state response. We could look at altering Iowa's wage structure. You can look at raising the minimum wage and indexing it to inflation. Iowa's January 2008 increase was a good start. It's already been caught up with or matched by the federal increase. However, we could index Iowa's minimum wage to increases in the cost of living going forward that would better help support this essential wage floor and close the gap between incomes and family budgets. As a state, Iowa could also seek better jobs. Unlike the federal government, which I think Kevin said doesn't have tax credits or doesn't have money for creating jobs, the state does. Iowa runs a wide variety of economic development and business incentive programs to attract new business here, to draw them to do research, and there's a variety of things that we invest in as a state. And these could be modified to focus on wage and job quality. They could be modified to say, if we're going to give you a subsidy to be here and we're going to invest in your business, then we want to ensure that you're going to provide wages that actually support families at a certain level, that they don't drive down the median county wage, that we're not going to subsidize the business and then have to support your workforce and subsidize them because they're not making enough to get by. Another strategy is to invest in post-secondary education, particularly for low-wage workers in Iowa. We know that skills and knowledge, especially in an economy that's marked by rapid technological change, which is happening throughout our country, are key determinants to both family well-being and state economic growth. So research shows that higher wages are connected to the proportion of college-educated individuals in a state. And we've done some analysis ourselves. It not only helps, a worker's pocketbook, but it also does yield a pretty positive return on investment for the state. We found out that investing in a tuition education for low-income workers in Iowa would return $3.70 for every dollar invested in an associate's degree and $2.40 for every dollar invested in a bachelor's degree. And that's even with graduates leaving after this was invested in. It's really a substantial payoff. I was at a presentation last week, and the Department of Workforce Development Director, Liz Buck, made a comment that it's an educated workforce that is the basis for attracting and keeping higher wage jobs and employers. The tax credits just aren't going to make us competitive if we don't have a skilled workforce. And that certainly impacts the trajectory of Iowa in the future. The last area, and I'll spend a little more time on that, is work supports. Until wages come up in our state, we're going to have people that have a significant gap between what it costs to live in the community that they're working in and what they're able to bring home through employment. So work supports can help close that gap. In Iowa, here are some of the work supports that are available, and state policies are set up around each of these. Child care assistance, food assistance, the state and federal earned income tax credit, public health insurance, and the low-income home energy assistance program, also known as LIHEAP. Those are some of the work supports available to families. And so now I am going to go back to poverty for 1 second to say that in discussing work supports, we have to talk about the difference between the federal poverty level and a basic cost of living benchmark, which we're calling here a family supporting wage. The difference between the federal poverty guidelines and a family supporting wage is significant, and it impacts how effectively these programs actually help families work and earn more and how much they don't, because it functionally determines who gets the program and who doesn't. That's why it's important. The federal poverty guideline, which is used as the basis for determining eligibility, is derived from a very outdated formula from the 1960s, and it undercounts both transportation and housing costs, while omitting child care altogether. You've got to remember it. Child care is one of the largest expenses in a family's budget now. It wasn't even considered in the calculation, in the 1960s. There's also no geographic variation, and we know it costs more to live in Iowa City than it does to live in Des Moines than it does to live in Cedar Rapids, that these all have different costs. Our research indicates that the minimum wages needed to support a family are about double the poverty guideline across family types. So when you hear research say 200% of poverty, and Kevin's did as well, they classify it as low income, that's really what we're talking about, the difference between people choosing between having their child in child care, paying their medical bills, seeking medical assistance, getting appropriate food or not. I mean, they have to start making those trades because there's not enough to go around for all of their basic needs. Why that 200% is important, and just sort of a quick snapshot, is that if state-funded programs phase out before 200% of the federal poverty level, if we sort of use that as a more appropriate benchmark of need, they're not going to help people fully bridge the gap between what they're earning and what their basic expenses are. So when programs phase out before 200% in Iowa, such as child care assistance and food assistance, they're stopping before a family is able to pay for that on their own, and families are not left with enough to get by. The National Center for Children in Poverty worked with us to develop a family resource simulator, and they analyzed where Iowa's current work support policies are at. So this is really to demonstrate how well each one of our programs helps a family successfully meet their basic needs as they work and earn more. The programs are structured the way that they're structured now. A family is not always better off, as you can see, as they work and earn more. Otherwise, you'd have a steady upward trend of this graph. Food assistance, which is the first significant cliff, right there, it looks like $11 an hour, is followed quickly by child care assistance, which takes them below a break-even point. So they lose more benefits than they even have, than they are able to make up with their wage increases, just to cover their basic costs. And it serves as a real disincentive to work, I mean, the way our programs are currently structured. So looking at this more closely, when a family loses their child care assistance, they take an almost $6,000 loss to total resources. And between the loss of child care assistance and LIHEAP, and they're pretty much at the same time, around $12 an hour. This family is going to have to work his or her way up to $14 an hour before they break even again. Then, if they want to get back to where they were before they lost both of those public supports, they're going to have to earn $18 an hour to get back to that same point. I'm not sure how easily or quickly it is for anyone to go from a $12 an hour job to an $18 an hour job in that quick of a time frame. But when you're talking about less educated individuals, it just doesn't happen. The other thing that this slide shows, and it's something that we really want to encourage policymakers to think about, is the difference between when you end benefits abruptly, it creates this cliff, as opposed to when you phase them out more gradually. If you look at the loss of the federal and state income tax credit, you'll see there is no cliff. It gradually phases out. So as a family earns more, the subsidy or the refund is slowly tapered off. So there is a progression of the more you work, the more you earn, the better off your family will be. So this is our current policy arrangement. You can see all the major work support programs that I mentioned there. The National Center for Children in Poverty also developed a family resource simulator for us. This is available online, so you could find it at their website. You could put in information. There are 6 counties that are already pre-registered, but you could take our cost of living report and put in any county that you want and see how this works with the policies we have. They went ahead and worked with us and simulated 2 policy changes. We picked the 2 that happened the earliest on, and they happened before a family is really on their feet financially. We looked at raising the income limit for child care to 200%. We determined that was a more appropriate threshold of where a family could take care of themselves financially. And taking advantage of something called the federal SNAP program, Supplemental Nutrition Assistance Program, is now the new name for what was formerly food stamps. States can expand their food assistance program through an administrative loophole called categorical eligibility. But it basically allows you to serve more families. And this is actually getting some attention in the current legislative session. So when we get to questions and answers, if people want to know about advocacy, this is an opportunity. This is the impact. First, it phases out the food assistance cliff. That first cliff, it just phases it out, so it keeps going as a family earns more. Their resources continue to go up, and it phases it out more gradually. And child care assistance, this did not phase out. We just wanted to see what would happen if you moved it to 200%. You're still facing that big cliff. But at least it moved the cliff out to a point in time where when they lose those resources, the family then is not all of a sudden having to pull their child out of child care to go to an informal setting, or going into debt, or losing their job. And those are a number of things we found out that families do when they lose child care assistance before they have enough to pay for the cost of care on their own. So these are two policy options. We can simulate other policy changes. Those were the two we chose. And before I close, I'm just going to say there are other work support recommendations. I just wanted to point out those to you because I think they're easier to grasp, and there's some visual aids to go with them. But in addition to increasing eligibility limits for child care and food assistance, we are very much in support of phasing benefits out more gradually to avoid those cliffs, so families can count on that and that they're better rewarded for their work efforts. We think it's important to raise eligibility limits for Medicaid to address the declining employer-based health insurance. They're very low in Iowa. Medicaid eligibility is 70% of the poverty level. It's 300% for kids, which is a huge difference, but for adults, for working adults, it's 70%, and a lot of people are going without. We do also advocate expanding the state EITC because regardless of the party, people are very supportive of this, and it's a very good anti-poverty program. And we think it's really important to remind policymakers and, general constituents that we need to increase outreach to serve more eligible families. Most families that are eligible for programs are not receiving all those benefits, and that the cliffs I showed you, that assumes that they get all of the benefits that they're eligible for, and most families do not. And we lastly recommend that policymakers look at how these programs interact, so you're not losing multiple benefits at the same time and really setting families up for a bigger hole than they're able to climb out of. I'm not going to talk about these things here, but I just wanted to let you know that's the report for our general sort of overview of work support policies. Those graphs I showed you came from there. And we've done additional work on the return on investments for public expenditures in EITC, child care assistance, Medicaid, and post-secondary education to look at if Iowa were to put money into these programs, what would be the public benefits coming back out. And I thank you for the opportunity to share this information with you.